the young Jacynth grows up and enters the workplace. I sort of briefly touched on what you do at the moment, but how do you choose your early career, and what was it?
Fell into my early career. Actually, careers advice at school was, I mean, I don't know what it's like now, but it was kind of non-existent for me. And my careers advice at the time was actually I could either go and work in a typing pool, I could work in a shop, or I could work in a factory. Now, none of those was going to be my career choice. My mum was a senior lecturer, and my father was undertaking his master's. Education was really, really important in our household. So they just weren't career choices. School wasn't somewhere that I enjoyed, Lev. It just wasn't somewhere that I enjoyed at all. And so I didn't do well at school in terms of my qualifications, much to the disappointment of my parents. I didn't do well at all. I left early, much to the disappointment of my parents. I ended up on the dole, much to the disappointment of my
There's a
parents.
recurring theme here, Jacynth.
Which was, yeah, absolutely recurring theme. And one day my father said to me, things have got to change. You have got to find yourself a job. And so I did. I went into a nursing. I applied for nursing. I was fortunate to get through in the first round. A lot of my friends and people around me were applying to three, four, five different hospitals. I applied to one hospital and got through, irrespective of actually some of the things that were said. So my father had said to me, do general nursing and do not take anything but your registered nursing. And I was told things like, well, girls like you do very well looking after older people, or girls like you do very well in mental health. And I can just remember my father's voice resonating saying, no, general nursing, adult nursing, that's what you will do. And so that's what I did. Again, having to push through, and at interview being asked things like, well, what do your parents do? I mean, what did that matter? But anyway, I kind of pushed through and did my nursing. I absolutely love nursing. I kind of found my place
Mhm.
in life in doing nursing, which wasn't a career that I had thought about. It wasn't an initial career of choice. It was just a case of I went into nursing because I had to. And so I did my general nursing, absolutely loved it. I decided I wanted to work in the community. So I went and I did my midwifery. Absolutely love that, working as a midwife, delivering hundreds of babies.
Mhm.
And that is it's a real honor, yeah, to be a nurse,
Yeah.
to be a midwife. And then I decided I wanted to go and work in the community. And that out of probably all of my career was the most rewarding, working in inner city areas where women and families were really struggling to understand the system, really struggling to do the best that they could for their babies and for their children. And I felt privileged to be able to support them along that along that journey. So I think nursing, irrespective of what I've done subsequently, has been absolutely my foundation and my rock on
Mm.
which I've built my career.
It's fascinating because obviously I touched on it during the introduction. You know, in 2024, that led to you being awarded an MBE for those services to nursing. 24 years before that, in 2000, you became the first black executive director of nursing, or chief nurse at the time, and that was in the West Midlands for the Solihull Primary Care Trust. And the fact that you achieved that role was obviously testament to your professionalism and your dedication. But I guess it also indicates, if you were the first in the year 2000, the first black woman to have that role, there must have been also some obstacles for other women to achieve that. Can you tell us a bit more about what you encountered along the way?
Yes, you're absolutely right. Being the first and the only is incredibly challenging. And there were definitely obstacles along the way. Some of them were quite significant. I must add that not all of my career was a struggle. However, there were obstacles and barriers. They were all around, and I think I became quite adept at maneuvering around them, over them, through them. And perhaps my many years in athletics helped me to become a little bit more agile. But being a Black woman in a senior leadership position meant that I was often overlooked. I think my abilities at times were often underestimated. There were questions like, "Well, actually, was my appointment tokenistic?" Which I would really, refute and reject. I had worked incredibly hard to get to where I'd got to. So I'd be overlooked. I felt I was judged more harshly than others. For example, I would get asked more questions, um, such as I'd get asked, "Well, are you the executive director?" I'd get asked that a number of times as if I'd got it wrong. Um, I'd experience microaggressions on a regular basis. For example, comments on how I dressed, being ignored in conversations, being talked over, deliberately left out of emails and meetings that I should have been a part of. Um, I remember being continually questioned about why I had taken particular decisions or why I had been asked to attend perhaps a national meeting, as though somehow my presence needed extra justification. So those experiences had a real impact on me. And at times I felt isolated. And I talked earlier about my earlier childhood,
Mm.
about feeling isolated and feeling different. And I could feel myself withdrawing and becoming quieter and almost becoming invisible in spaces where I should have had a strong voice. But
Mm.
one of the challenges was it a challenge, was actually other nurses, other people who looked like me were looking to me for support, looking for me as a role model. And behind all of that, there was an element of imposter syndrome because I was experiencing anxiety. I was experiencing anxiety on the way to work, sometimes in the workplace itself, always wondering what I was going to face that day. So that's the unseen toll of microaggressions. And
Mm.
that's not a term I really like because actually it's not micro. It's often described as death by a thousand cuts. The exclusion, they chip away all the time at your or they chipped away at my confidence and making me question, do I really belong? Can I really take my whole self into the workplace? And so I believe that I had three choices. Um, One was to leave, which at the time wasn't an option, to stay and do nothing, which wasn't an option because it was really impacting on my emotional and mental health, or to do something different.